Somatic symptom disorder represents one of the most complex and challenging conditions in modern mental health care, characterized by the presence of one or more physical symptoms that cause significant distress or impairment in daily functioning. This disorder fundamentally alters how individuals perceive and respond to bodily sensations, creating a persistent cycle of physical discomfort and psychological distress that can be profoundly debilitating. The condition manifests through excessive thoughts, feelings, and behaviors related to physical symptoms, regardless of whether those symptoms have an identifiable medical cause or explanation. The diagnostic criteria for somatic symptom disorder require that patients experience at least one somatic symptom that is distressing or significantly disrupts their daily life activities. What distinguishes this condition from typical physical ailments is not necessarily the absence of medical explanation, but rather the disproportionate and persistent thoughts about the seriousness of symptoms, persistently high levels of anxiety about health or symptoms, and excessive time and energy devoted to these symptoms or health concerns. These psychological responses to physical sensations create a complex interplay between mind and body that can perpetuate and amplify the original symptoms. The prevalence of somatic symptom disorder varies across different populations and healthcare settings, with studies suggesting that approximately 5 to 7% of the general population may experience this condition at some point in their lives. Women are disproportionately affected, with rates nearly 10 times higher than men, though the reasons for this gender disparity remain subjects of ongoing research and debate. The disorder typically emerges during adolescence or early adulthood, though it can develop at any age and often coincides with periods of significant life stress or trauma. Understanding the etiology of somatic symptom disorder requires examining multiple contributing factors that interact in complex ways. Biological predisposition plays a significant role, with genetic studies indicating that individuals with family histories of somatic disorders, anxiety, or depression face increased risk. Neurobiological research has revealed altered pain processing pathways and heightened sensitivity to bodily sensations in affected individuals. Psychological factors, including personality traits such as neuroticism, perfectionism, and catastrophic thinking patterns, contribute significantly to the development and maintenance of symptoms. Additionally, social and cultural factors influence how individuals interpret and express physical distress, with some cultures more accepting of somatic presentations of psychological distress. The clinical presentation of somatic symptom disorder is remarkably diverse, encompassing a wide range of physical complaints that can affect virtually any body system. Common symptoms include chronic pain, gastrointestinal disturbances, neurological complaints such as headaches or dizziness, cardiovascular symptoms like chest pain or palpitations, and respiratory difficulties. What makes these symptoms particularly challenging for healthcare providers is their often subjective nature and the frequent absence of clear medical explanations. Patients typically present with genuine distress and impairment, making it crucial for clinicians to approach these cases with empathy and understanding rather than dismissal or skepticism. The diagnostic process for somatic symptom disorder requires careful clinical assessment that distinguishes between appropriate health concerns and pathological preoccupation with symptoms. Healthcare providers must evaluate not only the presence of physical symptoms, but also the patient's cognitive, emotional, and behavioral responses to these symptoms. This assessment involves examining the degree of distress caused by symptoms, the impact on daily functioning, and the extent to which health concerns dominate the patient's thoughts and behaviors. The diagnostic process can be complicated by the fact that individuals with somatic symptom disorder may indeed have legitimate medical conditions alongside their psychological symptoms. Treatment approaches for somatic symptom disorder typically involve multidisciplinary strategies that address both the physical and psychological aspects of the condition. Cognitive behavioral therapy has emerged as the most effective psychological intervention, helping patients develop more adaptive ways of thinking about and responding to bodily sensations. This therapeutic approach focuses on identifying and modifying catastrophic thoughts about symptoms, reducing excessive checking behaviors, and developing healthy coping strategies. Mindfulness-based interventions have also shown promise in helping patients develop a more balanced relationship with their physical sensations and reduce the anxiety associated with symptoms. Pharmacological interventions may be considered as part of a comprehensive treatment plan, particularly when somatic symptom disorder co-occurs with depression or anxiety disorders. Selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors have demonstrated efficacy in reducing both the intensity of physical symptoms and associated psychological distress. However, medication should be prescribed judiciously, as individuals with somatic symptom disorder may be particularly sensitive to side effects and may interpret normal medication effects as evidence of serious illness. The prognosis for somatic symptom disorder varies considerably depending on factors such as symptom severity, duration of illness, presence of comorbid conditions, and access to appropriate treatment. Early intervention and comprehensive treatment approaches generally lead to better outcomes, with many patients experiencing significant improvement in both symptom intensity and functional impairment. However, the chronic nature of the condition means that some individuals may require ongoing support and management strategies to maintain their improvement and prevent relapse. Living with somatic symptom disorder presents unique challenges that extend beyond the individual patient to affect family members, healthcare providers, and society as a whole. The condition can strain relationships, as family members may struggle to understand and respond appropriately to the patient's symptoms and concerns. Healthcare systems bear significant costs associated with frequent medical consultations, diagnostic testing, and often unnecessary procedures. Understanding and addressing somatic symptom disorder requires a compassionate, patient-centered approach that validates the reality of the patient's experience while providing effective treatment to reduce suffering and improve quality of life.